this was the challenge for this year, with the idea of to look actually what is available on the safety. In every randomized control study, you have to report the safety as well. So obviously, you do get in every single publication a comment or two about the safety of the acupuncture technique as well. But to try and get a global picture of where what is the safety of acupuncture, I had to go back. Some of it is not new from this year because some of the research doesn't actually happen, but many of them are quite new. So we'll start with what the authorities are saying, or the National Institute of Health is saying, and then we'll move through several studies that you can see, and that's the nice thing about it. You can see that the evidence comes from huge amount of patients and numbers, and that should really give you the confidence regarding our profession, not to mention the perspective that I will try and put later, or the context. So first of all, what the National Center of Complementary and Integrative Health says about acupuncture, and they say that acupuncture is generally considered safe when performed by an experienced, well-trained practitioner using sterile needles. Improperly performed acupuncture can cause serious side effects. So that's something very vague and simple because they're not going into the different schools and how many hours you actually study acupuncture, but they say that if you study it well, if you train, and if you repeat the do's and don'ts, you're likely not to get into serious problems. Bleeding is not a serious problem. It makes sense. When we hit a desk or when we hit a glass and it's broken, there is some bleeding. When we put needles in our body, it is quite possible that there will be a droplet of blood, and I'm not sure that it's even related to the experience of the physician, because sometimes it can really just happen, but that's quite expected, and we'll see some of it in a minute. More serious side effects, that has to do with the training of the therapist. So looking at what they, this is a publication from February 2018, it's a white paper by a consortium of looking at pain. It's a task force, and they wrote about acupuncture therapy safety, and they first of all mentioned something that has not been updated since '98 because nothing bad has happened since. So the NIH wrote in a consensus statement in 1998 that the incidence of adverse effects is substantially lower than that of many drugs or other accepted procedures for the same condition. We're talking about 1998, so that's 20 years ago. They already mentioned that not much is happening bad with acupuncture, and even less than what is happening with drugs. It shows that acupuncture is safe when it's performed by appropriately trained practitioners with infrequent minor side effects, where serious complications such as infection of pneumothorax are directly related to insufficient training. And safe use of acupuncture has been established in pediatrics, in pregnant women, etc. We will look at the data in a minute. So this is a statement from 20 years ago, and it means that if they have not updated, probably not much has happened for them to raise the red flag and say, you know, you should be careful. This is a publication from 2 months ago in the Journal of Family Practice. So, you know, when you start a process of lobbying for your therapy or showing evidence of yourself versus existing drugs or something, it takes them time until it trickles down all the way to the family doctors as well. And this is a study that was in this journal that actually answers a lot of questions. We'll be looking at it today. But one of the questions they ask is, are there any adverse effects or complications of treatment? And what they say is that acupuncture is a safe therapy, with most patients experiencing no adverse effects at all. Minor include post-treatment fatigue or minor bruising. Serious complications are 0.05 per 10,000 acupuncture treatment, and infections are also possible, but they are due to practitioners reusing needles. Now, in today's world, I've not heard of people that are reusing. All of them are single-use sterile, but maybe it's something from the past, and there is a reference. I didn't bother to look, but it could be something old, before there were sterile single-use needles. So that probably entire section could be taken off. But if you are experienced, if you've been trained, if you've been retrained and checked every now and then for your capabilities, likely that you're not going to cause any serious complication with any of your patients. So let's have a look at the publication. This comes from the Berlin group, from Benno Brinkhaus group. They do a lot of the research on allergy and asthma. We'll look at it later today. But they were the ones who actually did a big study, the one with the 230,000 patients. It's an observational study from Germany. It was asking patients to report the adverse events that they were suffering from. It included almost 14,000 doctors in Germany, which is a huge number of doctors. But this is what surprised me, because they had to have at least 140 hours of acupuncture training, and 15% of them had 350 hours training. You told me that in your school there are 900 hours, approximately 9 hours, and in Israel it's more than 1,000 for sure, maybe 1,200 hours of training on acupuncture. This is what they've had to go through. So relatively low threshold, but at the same time you will see the results in a minute. It included 200 and almost 30,000 patients. They had an average of 10.2 treatments, so we're talking about more than 2 million treatments that were given during this observational study. 8.6 of the patients reported some sort of adverse event, and that includes minor bleeding. We will see that in a minute. 2.2 of them required some sort of treatment. 40% of them occurred during the treatment, but that must be the bleeding, for example, and 60% happened after that, and there were no fatalities. We're talking about 2.2 million treatments and not a single fatality. The most common things were, not surprising, minor bleeding or hematoma, pain, all of it makes sense, or vegetative symptoms like fatigue, so post-treatment where the patient feels a little bit that they actually want to go to sleep or something like that, which we know is something normal. So it's not something to be worried about. Adverse events that indicate negligence or malpractice, like broken or forgotten needle, pneumothorax, or burns after moxibustion, happened at 0.1%. And there were 2 cases of pneumothorax out of 2.2 million treatments. 1 required hospitalization and 1 required just an observation, and there were no fatalities in that. So a very, very big study, the largest I've seen, with very, very minor things to worry about. That if you train properly, you can't really be exposed to or worry about. So then they summarize towards the end of the study what are the risks. And first of all, they say outright something that won't surprise anyone. Like all treatments, acupuncture can cause side effects. The following ranking is used. Common, which means 1 to 10 out of 100 people can have bleeding and hematoma because of the lesion of small vessels. Uncommon, 1 to 10. So this is the same ranking that is being done to drugs. In every drugs, when you open the leaflet, the booklet that you get with every drug, all of them are the 1 in 100, 1 in 1,000, common, rare, very rare, etc. So you have uncommon, 1 to 10 of 1,000 treated people. That would include, for example, inflammation of the application site, swelling, strong pain during needling, and local muscle pain. 1 to 10 out of 10,000 people being treated, so that's rare side effects already. We have local infection, redness, itching, sweating, decrease of blood pressure, increase of blood pressure, unconsciousness and stuff like that. And very rare, that's less than 1 out of 10,000 people treated, including singular incidents. So they were correct in presenting anything that happened, even if it happened only 1 single time. And you can see that that includes palpitations and constipation, diarrhea, etc., etc. And you have here pneumothorax as well. The application of heat through burning mugworts or moxa can cause burns. That's a surprise, right? So yeah, that's the summary of the recommendations. Let's have a look at another big study that comes from South Korea. Yeah?
This was German?
Yes.
From last year?
No, it's from 2009. You have the reference here. You will get the slides anyway.
Fine, I just need that one.
Yeah, that's the journal. I don't know, by the way, why they chose to publish it in a German journal. I can only assume that maybe at that time people were not interested in publishing it in in an English-speaking journal for some reason. That could be one of the reasons, and of course the fact that it was an observational study. But still, it is important for our profession. I would have expected to see it also in a, but I don't know, and I don't have the opportunity to ask the authors why it ended up like this. Okay, having a look at this study of 80,000 patients who suffered from musculoskeletal disorders in South Korea. So they included almost 6,000 inpatients and 75,000 outpatients. The patients, as you can imagine, and it happens many times in Asia where the practice is much more common. These patients had 32 acupuncture treatments, not numbers that we see in Europe. And the adverse events associated with acupuncture, or pharma acupuncture, I'll talk about it in a minute, were forgotten needle in 47 cases out of 80,000. That's okay, I think. Presynoptic episodes, so that's fainting in 4 cases, pneumothorax in 4 cases, infection in 2 cases, and they were mild, requiring little or no additional intervention and leaving without any damages. In Korea, they like a lot to do pharma acupuncture, which means that they also inject or use bee venom, and that's why they cover everything in there. So there's acupuncture and there's pharma acupuncture, and there's additional things that they inject as well sometimes, but we don't do it in practice, so I excluded all the data that is not relevant for us. Look at the frequency classification according to what is done for medicines as well. You can see forgotten needle happens at 0.01%, fainting occurs at 0.038%, infection and pneumothorax at 0.001%. That's not something that people have on their radar if they're well trained. And what they say here is that the take-home message from this is that possibly reflecting error reduction could be through education and corrective action as a result of the internal auditing, education sessions on hand sanitation and alcohol, and also appropriate needling retention and removal method in high-risk acupuncture points can prevent pneumothorax as well. So something quite simple that we should all be doing, and schools should be doing that, and then you can avoid some of the more serious potential adverse events. Having a look at the study that was published 3 years ago, this study looked specifically at patients who are using anticoagulants because they are more prone to bleeding, of course, and hematomas. And so this is a meta-analysis. What they found was 384 anticoagulated patients that had received almost 4,000 treatments. What they did see was minor to moderate bleeding, hematoma, one of them was a large hip hematoma, blood spot bleeding, typical for any needling or injection and controlled with pressure or cotton, occurred in 15% of the patients out of 350 treatments. And altogether there was one moderate bleeding event occurring in the 4,000 patients. So again, something very minor, and in our profession something expected, especially when you are treating patients, old, elderly probably, who are taking anticoagulants. You know that you should be more cautious in your needling and be prepared to manage it after you do the needling. And what they say is appropriate needling location and depth should take place. The observed 0.003 complication rate is lower than the previously reported 12.3% that happens when you do hip and knee replacement. So they actually compare it to operations, and they say with acupuncture you only get 0.003. This is the amount of serious side effects that you have when you actually do operations as well, but no one talks about it, as if operations are safe and there's no complications from operation. So as I said, this is the meta-analysis that was done on patients using anticoagulants who had some operations like the hip and knee replacement, and that was 12.3%, and the low level that in the study that I showed you earlier. And now we're coming to pregnancy as well, something very important. So there is the issue with pregnancy of which points to use or not, depends on the classics and beliefs and experience that you have. But more than anything, it's pregnant women do need support, not only during the pregnancy, but of course from things that they suffer during the pregnancy. And you can see that the most frequent condition that these patients had was lower back pain and fetal malposition as well. In terms of what the study showed, so this is a systematic review, it included 2,460 patients. The amount of, or the incidence of any adverse events, including the minor bleeding, was 1.3 per 10,000 sessions. Needling pain was the most frequent one, and what they conclude is that acupuncture during pregnancy appears to be associated with few adverse events when correctly applied. So if you have the training and education, you can't really go wrong. They do go into a little bit of discussion about the points that are forbidden points according to some of the texts, but they haven't seen anything interesting to report about that. And what they said is that they summarize that it's generally mild and serious adverse events are rare. The present findings should be given to pregnant women together with the effectiveness of acupuncture, especially for lower back pain and other pain, in order to put things in perspective and then decide whether they want to go on treatment or not.
How many was in that study? How many patients?
2,460. So if you're worried about all the bleeding that has happened during acupuncture, let's put things in perspective. And we'll look at versus standard medical care, we look at versus the opioids, and we look at other drug-related side effects that are usually not mentioned in the media. And that, I think, should help you put things in perspective. So first of all, this is a study that was published exactly 2 years ago in 2016 in the British Medical Journal, which is the third most important medical journal in the world. And they were trying to assess what are the rate of people dying from medical error. Now you can imagine that this is not something that anyone likes to report. No one writes, oh, he died because I made a mistake. But they did go into the files and try to find things that did appear as a medical error and assess the number of people that had died from it. So you can see, of course, like I said, first of all, medical error is being considered as an unintended act, of course, doesn't achieve, when the treatment didn't achieve its intended outcome, or the failure of a planned action to be completed as intended, or the use of a wrong plan to achieve an aim, or a deviation from the process of care that could have happened during the time. So it's not, other than the name error, it's not intentional, of course, but these mistakes that people do. And death certificates in the US used to compile national statistics don't have a code for medical error. So you have to look in the files if you want to try and find something. The assessment that they did was that we're talking about 210,000 to 400,000 people that die every year because of medical error in the US. And when you actually look at it visually, this comes from the CDC, which is a Center of Disease Control in America. It's a body that controls how many, or registers how many people die from whatever. You can see that the biggest killer in America is heart disease, then you have cancer, and then you have medical error as a third killing. And that's an underestimate. They give other, if you read this article, which is freely available, I think, you will see that there are other reports that have gone up to 400,000 and 500,000 people being dead every year, but they took the more conservative approach and calculated it as around 250,000 people that die every year because of medical error. So you can see that that is a little bit more threatening than acupuncture. And then we have the opioids, of course. So talking first of all about the side effects, you see 1.3 million Americans needing hospital care every single year because of opioid-related issues. That's not the death, that's the issues related to using opioid issues. In fact, that comes again from a brochure that the CDC did regarding the opioids, and they say that every 3 minutes a woman goes to the emergency department for prescription painkiller misuse or abuse. In fact, when you translate it to number of deaths, and we will look at it later in the pain section, between 2001 and 2016 in the US, the number of opioid-related deaths in the United States increased by 345%, from almost 10,000 to 42,000. So that's incredible number. Or from 33 people dying per million of the population to 130 people dying per million of the population. So that's putting it versus the opioids. Then we have drug-related side effects and death. So imagine that you wanted to market yourself and say, you know, I'm an acupuncturist, come to my clinic, and then the people will ask you, what are the side effects of acupuncture? And you would give, oh, you'll suffer from vomiting, nausea, you'll be sleepy the following day, you'll suffer from anxiety, diarrhea, confusion, and more. This is a mild drug. Ambien is a drug for sleep, made by Sanofi Aventis. And this is just a list from them. You can imagine there are other drugs that cause even more serious. I think that if you told in your Facebook or your commercial page that that's what you promise with acupuncture and some help maybe, I'm not sure that many people would come to your clinic. So putting things again, everything has to be put in perspective of what are the possible damages with our profession. There are, people can die, but what is available out there that a lot more people are using and are exposed to and is problematic. And in fact, when you look at a new article that was published this year, they were looking at new prescription drugs and how are they in terms of the damage that they cause and side effects. And you can see that even properly prescribed, so when the doctor prescribes a medication and make sure that they do tell the patient what are the main side effects and issues that they should be looking at and or taking care of, you can see that you have about almost 2 million people hospitalized every year for the side effects of the drugs that they're taking. And we're talking about additional 840,000 people, hospitalized people who are taking drugs that are suffering from the side effects of these drugs, that they need to be hospitalized. Because many people, and I'm sure you've taken drugs yourself, that take the drugs and they don't feel well and they stop it. And then they go to the doctor again and say, you know, this doesn't work for me, or I'm in the toilet all the day, I need something else. But this is not the case. We are talking about drugs that have caused, from the side effect, caused to be hospitalized. And then the assessment was that 128,000 people die from drugs prescribed to them. That includes the opioids. So 80,000 are from other drugs, 40,000 are from opioids alone. And if you look, and that makes prescription drugs a major health risk. In fact, it ranks at number 4 with stroke as a leading cause of death. If you look at the European Commission, they assess that about 200,000 people in Europe are dying every year from the side effects of the drug. And that, of course, includes opioids as well. So in total, we have 328,000 people dying every year in the US and in Europe from prescription drugs in total. And that, of course, causes the authorities to do monitoring all the time. And they report things in a quarterly manner. You have here the FDA adverse event reporting system that every 3 months, every quarter, they do a report of what happened the 2 quarters before, so that they can then assess if they want to change the prescription information, the prescribing information of the drug, and tell the company that they need to change it or do additional monitoring. In the UK, they have the yellow card system, which is the yellow card making medicines safer, and essentially they ask people to report if they suffer from adverse events, and you can go into the system. It's a free system that is available, and you can click in on whichever drug that you want to. I took a statin here, atorvastatin here, and you can see here that the total number of reactions that existed were 12,000 reactions since it was approved in the UK. Total number of serious was 3,800, and 100 people died out of it by using a statin, which is relatively safe, You can see here that they also report by sex and by the type of event. Non-serious was the smallest, serious was much larger, and the fatalities that you have as well. And if you look at the list of things that people suffer from, you can see things that, again, if you published it on your website along with what are the dangers of acupuncture, you won't have anyone coming into you. So these are things that you have to go and look for, and it only reaches the newspaper when someone dies. When someone really dies or they are serious of death, then suddenly we hear about it. But when there's someone having a hematoma or pneumothorax injury, it hits the headlines immediately. When the study fails with acupuncture, and we'll see a few failures with fertility, it's suddenly the headlines. Acupuncture is not better than a placebo. So that's quite interesting to see, but it's more important that you know what the evidence is, and then you can talk about it and put things in perspective. So at the end of it, I go back to the word of perspective. The most important thing is putting everything in perspective. This is a quote from Bruce Lipton, who I really like. He's the one who wrote a book about the biology of behavior, which means that we essentially determine everything that we think. But again, he says that perspective is always limited by how much we know. And when we go up a little bit from our little world and get scared about bleeding, or even pneumothorax, which I take very seriously because people can die from it, but in most cases they don't, and you go up and you look at the entire universe, you can see that we're in a much, much, much better place, and that can really transform the way you think and the way you present, and also how you react when you actually hear about these news. That's the safety section. Any questions?